Does anyone think of surgery as a failure? The fact that somebody has to go to surgery, the fact that a surgeon operates on somebody, that's a failure. Let me give you many examples. So I had a patient who was pretty ill and they had C. diff, colitis, which is a resistant organism that infects your colon. And their belly was pretty distended. They weren't pooping. I was like, oh, this is going south. Not doing well. And they called a surgeon and they're not going to operate because that's only for emergencies. But when you look at toxic megacolon, which is the emergency situation where your colon's so swollen, right? So big, nothing's moving there. The mortality is really high when they operate. And they operate in those situations. So they said, yeah, unless the patient's on pressors, unstable, then we operate. Surgery is for failures. Surgery is for when the patient is not doing well and will not do well, right? Surgery is for when medicine wasn't enough. We try to treat many people without surgery. And when you think about the world we live in, right? There's this trade-off. Investments now versus the future, right? How do I use my time? Do I use my time so it will produce something in the future? Or do you use my time now to enjoy myself, which is not productive, right? We look at investing in stocks, right? We think, well, can't use the money now, but hopefully I'll get more money in the future. If you think of surgery, I had a patient who was elderly in his 80s and needed something for his heart. Do you do open heart surgery and give him a bypass? New blood vessels for the heart, or do you do stents? So if he got open heart surgery, he wouldn't be walking out of hospital a day later after his stents. He'd be recuperating. You're taking away his time that he realistically may not have that much of left. I mean, we have some medical stuff sorted out, but if you're that old, you're still liable to die more likely than somebody 40, right? And you're investing in the future, if you want to put it that way, by taking away his time now. And is that always a smart choice? You think about young people, right? You think, well, if I'm doing this therapy or recuperating, it's worth it because I have 40 more years left. But if you're recuperating for 1 month and you're 90 years old and you have a few years left, right? That's a large proportion of your life that you're using, investing, or shall we say throw it away as well, right? If it doesn't turn out. And I feel like that's the thing with surgery, There's recovery. You cut people when you disturb their normal anatomy. There's a healing that's required just from the fact that you open somebody up. Patients should do better without surgery. The problem is sometimes we don't have good ways of fixing stuff, right? They say surgeons fix stuff, and they do. But they fix stuff usually by just getting rid of organs. So yeah, your colon was doing poorly. Let's just cut out the bad parts and sew you back up together. There, you're healed. Go on home. And they do. But they're still missing part of their colon, right? They're not made whole if you use the literal sense of the word. Think about it from another perspective. So your gallbladder is inflamed. Does it need to come out? I mean, nowadays we usually do, but we said so with tonsils. We still deal with the appendices. Is it the right thing to do? Just take out organs because they're not working well at this time? Is there a chance they could recover? Or rather, should we develop stuff so they can recover, right? I mean, the liver. Oh, your liver is bad. Let's just cut it out. Sorry. I guess I can't cut it out because you need it. Okay. Well, let's work on fixing your liver. I mean, heart's the same way. There's organs that we work on fixing and there's organs we just cut out. Does that make sense? We're just cutting out everything and throwing it away to get rid of the problem, right? It's like the silly joke, right? Patient says, oh, my elbow hurts. And they're like, oh, so let me cut off your arm. Well, there we go, fixed it. That's not really fixed it, right? And I feel that's the thing with medicine, right? I think we have to accept to a certain amount that surgery is a failure of medicine. Medications, other supportive means, other preventative measures from preventing people from getting so ill. So I have to stand by my statement, my assertion. Surgery is a failure of medicine.